there's been talk about DOGE, more generally, but turning to Medicare and Medicaid fraud. And I know Obama's chief economic advisor for a while was Christina Romer, a highly respected economist, who at one point had published a study where nearly 30% of Medicare, she said 30% of its expenditures could have been cut without any effect on patient income. So there's a lot of, I don't know if it's waste, fraud, or abuse, but there's a lot of looseness in that system. Do you think DOGE or somebody, how do you cut Medicare expenditures without having, every senior citizen in their personalized rascal scooter marching or driving on DC?
Right. And the fundamental principle is we don't want to touch access to care.
Right.
That's not the right way to try to lower costs in the healthcare system. Right. It is going after this proverbial waste, fraud, and abuse. And there's a lot of this stuff has been identified. We've identified some of it. Many other people have identified most of it. Right? It's always been more of a political problem. And again, the healthcare lobby is the most powerful of any in the United States. It is just amazing how many dollars and how many bodies they have in DC to try to make sure that the system doesn't change.
How do you cut that?
Yeah, so it almost needs a forcing mechanism, right? And you find that whenever Congress wants to introduce something new, and also feels compelled to pay for it. So in the IRA, Democrats put in pharmaceutical pricing provisions in it to save money. And now with the TCJA extension, that's probably going to cost $4.5 trillion or so. And at least in the House reconciliation instructions, they've mandated at least $2 trillion of savings. And so now you have this forcing function that necessitates finding money, finding savings. And without that, Congress wouldn't act. They know this stuff. The people on the committee, they know it. But this is just part of the political process that until they need to pay for something that they want even more and are willing to infuriate all those lobbyists, then it doesn't happen. And so we have this very interesting window that's going to happen sometime this year, right, where it actually is, okay, we need to find hundreds of billions of dollars of savings in the healthcare system. And there's more and more consensus that Congress doesn't want that to come from access. And so then you have to go into the waste, fraud, and abuse.
That's an excerpt from my podcast, The Reason interview with Nick Gillespie. If you want to see more excerpts, go here. And if you want to see the full Q&A, go here.